Hello, everyone, and welcome to the latest episode of the Metabolism and Menopause podcast. My name is Stephanie, and I am your host and CEO of VitalityOET. We are a women's nutrition, health, and fitness company that focuses predominantly on women's hormones, particularly as they start going through perimenopause and onwards. We know that you start experiencing so many changes in this time of your life, whether it be hot flashes, night sweats, irritability, brain fog, or that waking around the middle that seems to have come out of absolutely nowhere, despite you not changing anything. So you go back to those tried and true methods of cutting calories, cutting carbs, doing a bunch of cardio, doing all the things that used to work. But now it feels like you're putting in all this effort and you're actually moving in the opposite direction. But we know now that your body is inherently different than when it was to you prior to experiencing these hormonal changes. So our mission here at Vitality is to really help you understand how your body changes in this time of your life, so you can reach those health and fitness goals, live a life full of vitality, feel in control and at home in your body again, and really understand how to take care of this new body of yours. So today we have a wonderful group podcast. I have some of my coaches here. I have Coach Corinne, I have Coach Brittany, I have Coach Kariana, and today we wanted to talk about hormonal symptoms because there are a lot of things that we start experiencing that we aren't aware are actually hormonal symptoms, or we feel like they're just kind of weird things that start happening. And it actually has to do with the changes that we start experiencing during menopause. So we want to touch on some of the things that are like maybe that you think of, but then a lot of things that you don't think of. Like one that I wanted to mention that we were doing some more researching, and obviously the conversations that we have with our clients and stuff, but one really weird one that we found comes up is burning tongue, which is so weird. It's a condition that simulates almost like a fiery sensation in your mouth and your tongue. And it happens in 40% of menopausal women, which is so wild. So it can create sometimes a metallic kind of taste or dryness or soreness or tingling. And research is starting to show that they think it might have to do with a drop in estrogen, but that's one people don't think of. But what we're going to talk about is just some of the more common ones, some not some common ones, talk about how it shows up in our clients, and really just dive into all of this stuff. So Kariana, what is one that you see pop up a lot, or you talk about women a lot, talk to women a lot about, that you're seeing in menopause that people don't realize is a menopausal type symptom?
So one of the big things that I tend to see for a lot of women is they will notice that there is thinning or a loss of hair on their head, and they also get brittle nails. This is typically due to, for a lot of women, an increase in what we call our androgens or our male hormones. And this can actually shrink hair follicles, especially if when we have high stress, some women tend to get very high secondary androgens, something called DHT, which can cause really extreme thinning hair on the head, but then also hair growth on the jawline, as well as any kind of acne and stuff on the chin. Some women can get bald patches. They can get this really undesirable type of peach fuzz in different areas, either on their head or on their body that they never got before. So the hair growth / hair loss just gets a little bit odd and a little bit weird. And it usually can be accompanied by these really dry, brittle, cracked nails that they never had before. And, you go, you're iron tested, everything there is fine. This is typically a symptom of an increase in these secondary androgens, because when we go through menopause, as our estrogen and our progesterone start to decrease, for some women, testosterone is supposed to stay high, or, even get higher to kind of take over that role that estrogen used to have. However, again, as we said, with high stress response, sometimes those communication pathways get a little bit messed up, and then these high secondary androgens get overproduced. And that's when we see the thinning on the head, the hair growth on the face, the weird occurrence of acne, the brittle nails, and that can also be accompanied by other symptoms of those high secondary androgens, like dark patches of skin, skin tags, if you suddenly get a bunch of skin tags, and you can get the dark hair growth on your arms, your abdomen, your chest, other places other than the face as well.
So I see this a lot in women with PCOS too, the high androgens, and those type of symptoms. So sometimes I feel people have it and they don't realize that it has to do with hormones to begin with. And then they hit menopause and it gets worse, or all of a sudden they hit menopause and they start developing these other hormonal imbalances. that women really aren't really aware of. Corinne, like, do you see any women that are like dealing with like thinning hair loss? Like, what are some things that you've done with women to kind of help them through that?
Yeah, 100%. I hear this a lot. And something I always love to look at, other than obviously we're bringing up and regulating hormones, but diet, like the composition of your nutrition makes a huge impact. And I notice thinning hair and brittle nails a lot with women that traditionally eat lower fat. So I try to get them to increase their fats. We get a better composition from their fats, making sure they're healthy sources of fats, like especially their omega-3s, to really enhance that fat absorption in their body and make sure that we're combining things well. So that way we're getting enough of those nutrients in to provide the fat that we need for healthy skin and nails. And then another piece is also for some people, collagen, like having enough collagen protein sources or animal sources of protein will provide enough of those like healthy fats as well to make sure we're taking care of our hair, skin, and nails.
Yeah, like I see that a lot with like women who have low protein diets. Their nails will get like worse, their hair will get worse, skin will get worse too, right? And I think that's like yes, it comes with menopause because of hormone changes, but a lot of the time like our protein content gets like worse and worse and worse, especially if we start like fasting and stuff like that. It just ends up getting very hard to like get enough protein in. So like another thing that we hear about a lot, and like this can be associated with like PMS too, is those wonderful headaches and migraines. So Brittany, I know you know so much about this topic, especially relating with like PMS and stuff. So why don't you chat a little bit about how these headaches and migraines kind of fluctuate with hormones and what we're kind of seeing?
Yeah, absolutely. So I know a lot about this because I deal with this myself a lot. But, headaches and migraines, really, really common through, I think, all of women's hormone shifts in life, right? So puberty, pregnancy, postpartum, perimenopause, of like into menopause, right? And it all has to do with the balance of the estrogen and the progesterone. So oftentimes we get them, interestingly enough, when estrogen goes low, but we also get them when we have estrogen dominance. So we get pretty bad migraines and stuff with that. And then also when progesterone is low. So, the cool thing is as we kind of go through our perimenopause and into menopause, as our hormones adjust and we stop getting those really big shifts and highs and lows and everything like that, we are going to see that the headaches, the migraines, kind of whatever you're getting more often starts to decrease. And then most of the time they will stabilize and you won't get them as much anymore. But it's really, really about kind of that hormone imbalance that we see. And for a lot of women who have them premenstrually, they're going to have an uptick in them when it comes to perimenopause because of all of those fluctuations that happen. So, it can be debilitating for a lot of people. Just the amount that they get. I know, like, personally for me, and I also have had clients like this where they're getting 1 to 2 migraines a week. And that is so hard to manage because it's, how do you function? A migraine can take somebody down for a day or two. So a lot of the things that I like to look at, obviously, other than like trying to support all of your hormone levels, right? Because we want to look at estrogen. We want to make sure that we have adequate amounts of estrogen, but we also want to make sure that we are detoxifying estrogen properly. We want to make sure our liver is really happy. But honestly, I think the biggest mover is gut health. So because, so much of our estrogen is processed through our gut, that is going to be the big driver of these hormone headaches, hormone migraines that we get. So really working on integrity of the gut, making sure that we are having adequate bowel movements on a daily basis, making sure that we don't have any like kind of dysbiosis or, if we're having food sensitivities or food allergies, which we all know can increase as we also go into perimenopause and menopause, kind of taking care of those things and really weeding out the things that irritate your gut, because that's going to have a significant impact on these migraines and these headaches.
Well, I remember getting my first migraine in university, and like, I was in like my second year, I think. So I was like living like in an apartment on my own. And I remember like the pain behind my eyes. And like, I remember puking profusely. Like it was so, I was like Googling, automatically thought I had a brain tumor. Like I was convinced I was dying. Went to the doctor and she's like, oh, like this is just a migraine. I'm like, just a migraine? Have you had a migraine, ma'am? Like this is brutal. And it used to happen to me all of the time. And like part of it was like straining my eyes. Part of it was dehydration. But then also after like getting some tests and stuff done, like my PCOS and my like hormone levels not being good, the birth control that I was on, like it was just so many things to weed out. And I don't think people realize like how birth control can also like contribute to headaches and migraines. It just throws everything off. It affects your gut health, all that kind of stuff. But so like Kariana, what would you like when you're working with someone with like a migraine or is having recurring migraines and headaches? What are like your like top like 3 tips if someone was struggling with that you would tell them to do?
Okay, we get quite a few clients that do come in with like migraines for sure. It's definitely a more common symptom than you think of the menopausal transition. One of the big things that and of course, it's really important to be clear with the fact that our evidence-based coaching is all about trying things that we think will help and then seeing how the body reacts and then changing direction based on what the body is telling us, because everyone reacts very differently to different things. One thing that I would always try and make sure of is the first thing I would probably try is like some kind of phytoestrogen, because typically with these headaches and these migraines, estrogen balance is kind of the first thing that we look at because of that sudden onset in the menopausal transition. And so if we can incorporate some kind of phytoestrogen to help support estrogen production and detoxification and balance in the body, that can have a huge impact on the frequency or the intensity of migraines and headaches going into menopause for some people. Some people it doesn't work. Some people it works really, really, really well from a nutrition standpoint. Another thing I would always do is just make sure we're consistently eating that calories or that energy intake, because the more consistent we are, the more our body can help restore hormone communication pathways. And a lot of the times, remember, the migraines and the headaches can be a byproduct of the body being like, I don't feel comfortable. I don't feel safe. And menopause just unfortunately amplifies that as we go in and lose those hormone buffers that used to kind of like keep us a little bit more sane. So I would say those are probably the top 2. Another bonus one that I would always do with women who do get a lot of headaches or migraines, and I do get a lot of women that come in that get headaches and migraines after they do like intense exercise too sometimes, is making sure that we have the right intensity of exercise, but then also doing a lot of work to strengthen the back and the neck muscles properly, because a lot of the time I do see there are some migraines that come on from strain in like the neck or clenching their jaw or like not doing exercises properly because they don't have the stability muscles in their back, their neck, their rotator cuffs that actually can help stabilize them during workouts as well. So that's kind of like a little bonus one. I always assess the situation, but that is definitely something that I see a lot of too.
That's something I actually used to see a lot in my osteo clinic when I was working with like lots of clients and stuff, because they're like, oh, the back of my neck is sore. I keep getting migraines. And then they keep getting it released and massage and massage and massage. And I'm like, okay, but the issue is like your neck is straining forward. Your chest is tight. So like where you're feeling issues isn't the actual cause. It's just like hormones and stuff. It's like, what's causing this to happen? And like the imbalance is actually like things in the front of your neck and in your chest and shoulders are so tight, and your back is actually weak, but it feels sore because it's working so hard and it's stretched trying to pull you back and it can't. And I always think that's like a super, like when I explain that to people and they started doing stuff, and it doesn't even take that much. It's like just being mindful of like stretching the chest, stretching the neck, and then like just honestly doing like banded rows and stuff, like just to get those muscles like working again. It's wild how much better like headaches and migraines would be. And that was a big changer for me when I started doing like back strengthening exercises. It was wild how much that helped in like occurrence, but I wouldn't feel that tension in my neck all the time.
And we have to remember too that like a lot of us hold a lot of our stress in our neck and our back and our traps, right? Like that's, if we're stressed, like we don't even realize that like suddenly we're all tense. I think a lot of people don't realize that the body does hold on to stress physically too. So also something to keep in mind.
Big time. So another cool one that I'll ask you, Corinne, is the voice changes. I actually have quite a few friends who, like a lot of friends who were like, I don't know what's going on with my voice. Like things are really weird right now. And I don't think they realize voice changes actually do happen to a lot of women during perimenopause and menopause. And this is something that like a couple of my like actually quite close friends, when they started going through this, were like, they were freaking out. They're like, I must have throat cancer. Like that, everyone thinks everything's cancer, right? They're just like, this isn't right. I'm dying. Something bad's happening, right?
Immediately. It's always, I need to Google this up, and that's what it always is. So big thing. Yeah. A lot of people do not realize, I mean, it's really common as you see with guys as their voice changes and we're like, oh, that's normal, whatever. But with women, it's also a very big sign of what's going on inside your body. So as estrogen and progesterone, tick down and diminish, testosterone rises, obviously that hoarseness in your voice can change. The pitch can come down a little bit. You might experience where your vocal cords are just like a little bit weaker. They get tired very easily after speaking for a long amount of time. And it really gets overlooked quite often. So it's something that can be a sign. And so be aware of how your body is changing in many ways. It's like we think of the physical all the time, externally physically, but what about more of the internal physical things that are going on? So your voice is a big thing. Sometimes people even just acknowledge like your gut changes. Those are things that are internal, but it's definitely happening. And it's not that it's irreversible. It's not that it's something that's, a terrible sign that's going on, but at least it gives you more insight into your body of this is what's happening. This is what's going on. So the more information you can pick up on, the better connection you can have with your own body, the better off you will be in taking care of those things and moving forward.
Well, and I think that's the thing too, is like people are like, oh, these are just symptoms that happen with menopause. I just got to deal with it. And it's like, no, like there's so much that you can do to address these things, to help things be more balanced and get rid of these symptoms like naturally, right? Like it doesn't have to be like, oh, that's menopause. Okay, then fine. Like, no, it's like we can still work through this. We help people through it all the time. And like, just like you were talking about the digestive problems, like that is so freaking common in perimenopause and menopause, where people are like, my bowel movements are not regular. I won't go to the bathroom for like 3 to 4 days. I might start having like heartburn, or I might start having like indigestion, more like bloating that I never struggled with. And people are like, okay, but I didn't change anything. I didn't change my diet. I didn't change my exercise. Like I didn't change anything. Why is this happening? And people like attribute things to like what they're like actively trying to change. And it's like, okay, but things are changing inside of you. And I don't think people really clue in on that. They're like, oh, I'm gaining weight. It must be something that I'm doing different. And it's like, no, it's what's going on inside. And now we have to like teach you how to change things based on these internal changes that are happening. But we are always like, oh, I gained weight. It must be because I switched from this exercise to this exercise. And it's like, no, it's the internal stuff. So you're attributing that change to an action that you've made different, but it's actually changes inside of you. So like with the digestion stuff, I've been like diving deep into this stuff lately because I just think I always like this stuff. So, but I found it very interesting that heartburn is like associated with like lower estrogen levels, because when estrogen is lower, it's harder for your body to produce stomach acid. And then that can lead to like your like sphincter in your esophagus not closing properly, which can like make it more likely you'll have more heartburn and more acid reflux. And like, it's just, to me, I'm like, this is so fascinating. When I talk to like people in public, they're like, this sounds terrible and you're putting me in a bad mood. I'm like, no, but it's so cool. And like, now we know what's happening and we can deal with it. But like a lot of the things that we're seeing with like digestion issues and more acid reflux and the indigestion and all these things is because our hormones change. And it is realizing that when we're under a lot more stress, that makes those changes worse. So like, we're pushing harder and like taking these medications that aren't necessarily addressing the root cause, where it's like, okay, if we could just like help support your estrogen levels a little bit more and reduce your stress by making sure you're eating consistently, that you're, eating enough food, you're pairing your foods properly, that'll help with your natural hormone levels, and it'll help with these other side effects. But we panic and then like go to the extremes, which actually can be like more detrimental to our gut health and stuff like that. And we do know like it's a lot easier for us to get stressed. So our blood flow goes away from our gut. It goes to our arms and our legs, and then digestion slows down even more. And then we're seeing more inflammation. And like, it's just like this cycle that just keeps happening, but we keep pushing harder, which just like keeps us on this hamster wheel where it's like we can't get off. When we realize if we did a little bit less and just focus on a few really key things, it can help improve all of these symptoms, which is like really, really great. So the next one that I want to talk about is like urinary and fecal incontinence, or like having to go to the restroom a lot or like more often. And a lot of people think like, oh, pregnancy and like my pelvic floor just got worse because of like, I've had babies or whatever. But actually, we see this happening to women a lot through perimenopause and menopause. And like Brittany and I did a whole podcast on this, but Britt, I'll kind of let you talk a little bit about this whole concept, because I think people just assume, oh, it's because I had kids and now my pelvic floor is like, quote unquote, ruined or whatever, right?
Yeah, absolutely. I think that's the most common thing I hear. I think I've said this before a couple of times, especially working with the postpartum group of people is, oh, well, I've had a baby, so it's just normal to leak urine. And it's like, no, it's not normal, right? It's common. It happens to a lot of people, but we can't normalize walking around peeing our pants when we laugh, sneeze, cry, jump, pick up our kid, pick up a weight. Like that's not normal. And the thing is sometimes you don't even have to have a kid, right? We don't have to go through childbirth, and we still have urinary or fecal incontinence that happens to us as we age. And the biggest thing there is because it's again, that lovely change in estrogen that happens, but we have those lower estrogen levels, and estrogen is really important for tissue health and integrity and muscle health and integrity. And the pelvic floor, which houses and supports all of our organs in the lower pelvis, right? So our bladder, our rectum, our cervix, our uterus, all of these things. It's made of tissue and muscle and fascia. And so it's going to be directly affected by the change in estrogen levels, right? So we often see people who complain about, oh man, I'm starting to not be able to make it to the restroom when I have to go to the bathroom. It's like I have an accident on the way there, or oh my gosh, I'm starting to sneeze and laugh, and I have to cross my legs and like cross my fingers and hope that I don't pee my pants, or, oh my gosh, for the first time, I'm not able to hold in my gas. I can't hold that back, and these things happen because of that change in tissue. It becomes less pliable. It becomes like the muscle doesn't work as well. It becomes, I don't really want to use the word brittle, but it kind of starts to become brittle, right? Like because of that loss of estrogen. Same thing with vaginal atrophy, right? It's the same thing. We've talked about that too, is with the vaginal tissues, they start to get weaker. They start to become thinner. They start to not be as supportive. And then they become atrophied, and they lose kind of that give sensation, right? The strength, and then also the pliable sensation that they need to have. It's the same thing with that pelvic floor. And this is a really, really common thing. And a lot of women just kind of resign themselves to, it's like, okay, well, that's just what's going to happen as I age, right? But there's so many different things that we can do, right? HRT is one of them. And I always say, yep, that's always an option for people. You can do, you do all different kinds of HRT. But there's more that we can do, right? One of the biggest things is like training our breathing patterns. So often the way that we breathe is we breathe super shallow, and we put a lot of pressure on the pelvic floor as we breathe. And people don't really connect like the breathe, like as you breathe, your pelvic floor is actually moving, right? We don't think about that, but it's got a huge connection. And so retraining breathing patterns, making sure that we're actually using the diaphragm properly, which actually is going to help with like subsequently like back pain, sometimes stomach pain, rib pain, all of that kind of stuff, because we're learning how to breathe properly. But, the other thing is we can actually do movements for pelvic floor support. So even though those tissues and everything are losing elasticity because of the hormones leaving the body, we can still proactively do things to help make connections to those muscles, help make connections to that area. So that way we can actually control better, especially if, oh my gosh, I'm running to the bathroom and I can't quite make it. We have more control over those things, right? I think I've also talked about this a lot, but all my clients, and whether they love it or hate it, I make them do pelvic floor breathing, diaphragmatic breathing, all of these like little tiny, they're like, why do you make me do this every single time you program a workout for me, right? You can get rid of the breathing. I'm like, no, actually we can't get rid of the breathing. We're going to keep doing the breathing. And inevitably 4 months in, they're like, hey, I was able to laugh and I didn't leak. I didn't have to cross my legs to laugh the other day. And I'm like, that's because of the breathing. Like, there's so many things that we can do for it. So we shouldn't resign ourselves to just, okay, this is what's going to happen. I'm just going to have to pee my pants for the rest of my life. There's so many ways that we can proactively help that.
Yeah, like I remember actually talking to a client of yours, I don't know, it's going to be a few months back now already. And she's like, we were on a call actually, like just a quarterly check-in. And she's like, I don't buy liners anymore, Steph. It is this beautiful thing. Like I just feel so good. Like I'm not like worried about not being able to laugh. And I'm like, that's so huge. You don't realize how much it's affecting your quality of life until that becomes like an issue, which is like really awesome. We actually have a guide on like pelvic floor exercises. There's links to videos with us like showing you how to do them and describe them. So if anyone wants that, just message me. I will send it over to you. It's little things that you don't think will do a whole lot, but if you're consistent with them, like you can get improvements like decently quick, and like you'll be aware how dysfunctional the movement is, or your ability to like connect to certain areas in your body that you don't realize. And I used to see this a lot with people that I would work with osteo, trying to get them to do like a cat-cow. And they're like, am I doing it? I'm like, nothing is moving. like I'll put you in front of a mirror, but nothing is moving. They're like, really? I feel like I'm doing stuff. I'm like, nope, you are just bobbing your head. That's all that's happening here. So I think that's like a big part of it too. It's like, if you don't use it, you lose it, right? Like if you stop speaking a language, you lose the ability to like be able to speak it, right? If you're not working out, you lose your muscle. Like it's all of those things. And so it takes some time to reconnect to those areas. And I don't think we realize how disconnected we are from our bodies, like all of the time, to be honest. Okay. So another one, yeah, like it's very, very easy. So another one that is, that we see quite common is the increase in allergies. So this is something where women are like, I had some allergies, but they never really bugged me until I got to 40, 45, 50, whatever age that is. And like, this actually happened to my mom as well. Like she always had allergies a bit, but like, I remember the last few years of her life, like, it was crazy how bad her allergies were. So, and we see this a lot with women. So Karianna, why don't you talk a little bit about that?
Yeah, so the increase in allergies is actually a very common thing that we see, and it's just something that no one really tends to associate with these changes in hormones. Now, of course, the first thing that I always want to be clear about is that stress is a very, very, first of all, primary form of allergies. Because stress will release inflammatory cytokines. It will get your immune system more jacked up. It can also increase production of histamines. So when we go into this menopausal transition, for some of us who are very high stress and we don't have those buffers anymore, like estrogen and progesterone that helped kind of like mask all of these things, your immune system can kind of get a little bit out of control. And this is why we also see that immune-related chronic diseases, like any kind of autoimmune conditions, your risk of developing them gets much higher as you go into menopause as well, because again, those buffers are lost. Your immune system can be flared up very easily. And those histamines in your blood or in your immune system can get produced a lot easier as well. So that is definitely something that I see. I see more amplified seasonal allergies. I see people getting like food allergies and then those autoimmune conditions as well. And Steph and I Steph, we've talked about this on a podcast before, I think like way, way back when the podcast first started. But the interesting thing is that a lot of our immunological genes are actually on our X chromosomes. And because we're women, we have 2 X chromosomes, whereas men only have 1, which is why as women, we tend to be a lot more prone to stress-related conditions and then immunological conditions like autoimmune conditions and diseases like that, as well as we tend to actually get way more higher instances of like allergenic symptoms as well. So women tend to get a lot more allergies than men as well. And I think has a lot to do with the fact that we just have like a lot more, we have double the amount of immunological genes in our body, which means that they can be turned on and turned off with stress or like environmental changes or hormonal changes a lot easier than, of course, men.
Yeah, and we know that like when estrogen goes down, our stress tolerance goes down. It doesn't take as much for our stress like response to go up. So this is why, like, as you can see, as we're talking about all these things, all these symptoms, like they get worse during menopause or they get worse with stress. And this is why. It's because we lose those estrogen levels and it doesn't take as much for that stress response to come up. And then we start seeing all of these other things, just like arthritis and joint and bone health, and like we start seeing more inflammation because we don't have that buffer. Like estrogen A helps with inflammation, but like B, when we lose it, it's not as hard for cortisol to come up, causing more inflammation in your body. And if you have more inflammation, that causes cortisol to go up and even more. And this is why women are all of a sudden like, man, like my joints are really sore, or like things feel a little bit more stiff, or it doesn't take as much to like aggravate things. And it is because like we are more prone to having more inflammation because it doesn't take as much stress to see that response as it did before. So this is where it's like, man, I used to be able to work out really hard and now I feel like I can't push as hard. And it's like, yeah, because you don't have as much helping your body to deal with the inflammation afterwards, which like you're supposed to have some inflammation after your workouts. That's part of how the process works. But understanding that there is such thing as like too much, like you're not eating enough food. There is such a thing as too much of a deficit, being low calorie for too long, not taking enough rest, pushing too hard in the gym, skipping our meals, the fastings, all those things, right? So I think that that's just like, people don't realize the effect that like the low estrogen and the stress combined together, how much that impacts and makes all of these symptoms so much worse. And that's where like, again, I think we go wrong and we try to push so much harder to like, try and improve all these things. And it just ends up making things actually a lot worse. So the next one that I wanted to touch on here is irregular heartbeats and palpitations. We hear this a lot. And that makes us panic more, right? We all think we're having a heart attack or something's going on. And it is something we see a lot. And women ask, like, should I be concerned? Like, I feel like I was doing good and like my blood work and markers are like fine, like my cholesterol's okay, but like, what is like, I feel like I can't get control over my heartbeat, and then it makes them feel more anxious as well, makes it harder to sleep, right? And so this is something we see in women a ton. So Britt, why don't you touch a little bit on that? Because I know this is something that we like, this is a very, very common complaint that women don't like realize is associated with perimenopause and menopause.
Irregular heartbeats and palpitations. I think this is probably one of the more scarier symptoms that we hear about in perimenopause and menopause. It's oftentimes you'll just kind of be sitting there and all of a sudden you'll have like a weird sensation in your chest. It'll feel for some people like a skip in their heartbeat. Some other people tell me that it feels like a flutter and like a butterfly fluttering in like the center of their chest or even up in their throat. And that can be extremely unnerving. Lots of times it can be associated with like a dizzy feeling or even a lightheaded feeling. Some people actually get their hot flashes after their heart palpitations happen or that irregular heartbeat happens. And it is, I think it's one of the symptoms in perimenopause and menopause that like doctors, they kind of have an idea of why it happens, right? So obviously it's estrogen related. Estrogen is very heart protective, but they also can't say definitively like, yes, as your estrogen levels go down, this is the reason why we have these heart palpitations and, the abnormal heart rhythms. A lot of it is thought to happen because of the severe up and down of the estrogen. I also correlate a lot of it to the increase in cortisol that happens during perimenopause and menopause, because we have such an increased stress response and our body just does not manage it as well, right? And so oftentimes things that can irritate heart palpitations or these irregular heart rhythms are increased stress, are emotional upset, things like alcohol, not having a great night's sleep. So if we're thinking about perimenopause, we already don't have great, estrogen levels all the time. They're kind of up and down. We already are probably not sleeping super great. We already have a reduced stress response and we have higher cortisol. And, then we also have all of the other hormonal changes that are happening, like the hot flashes, the night sweats, all of those kind of things that can precipitate these palpitations. So one of the biggest things that we can do, and the things that I have found most helpful, is to really, to actually stop yourself in the moment when you're having a palpitation, and clearing your throat can actually really help. I know it sounds really weird, but if people get a palpitation, and sometimes you'll get maybe a couple in a row, but clearing your throat can actually be really helpful for stopping it and for kind of getting your heart back in a regular rhythm, or to stop the palpitation, and to lay there and take a handful of deep breaths. If you're at home and you're able to, doing feet up, that kind of thing, but really focusing on either some kind of like box breathing or something like that in the moment, because that will help calm you. 2, that's going to, if you're going into a hot flash, that's going to be helpful with managing the hot flash as well. But 3, for long-term support, really, really supporting cortisol levels as much as you possibly can, and really working on sleep quality, because that's going to be one of the biggest movers there.
Yeah, like the heart palpitations are definitely like a very fight or flight nervous system type symptom, right? Like, because we're getting ready to fight the bear, run away from the bear, we need more blood pumping. So being able to focus on bringing your heart rate down, whatever that kind of looks like, but that comes with like regular self-care. That comes with bringing those stress levels down, doing things that fill up your cup, slowing down. But one thing I used to tell people all the time when I worked in like the clinic space is like, focus on exhaling. Because usually when we try to like slow down our breathing, we focus so much on like trying to inhale. I'm like, focus on your exhale, like focus on like fully emptying your lungs, doing that slowly. Because otherwise what happens when we focus on the inhale, sometimes we only like inhale and we only like exhale half of it out. So we're only breathing like the top half of our lungs. Whereas if we focus on actually exhaling fully, you'll be surprised at like how much better your breathing is. It slows down your breathing. Your breathing and your heart rate are so so intimately related. That helps like so much. I used to tell people that a lot when I worked at Orange Theory back in the day, where I was like, I want your heart rate to come down. And they're like, no, I need my points. I'm like, stop it and listen to me. Like, honestly, they should have fired me from there because I was so anti, like, do not get your heart rate up that high. Let's focus on recovering in between, slow down your movements. Like, let's focus on getting strong. And I was like, focus on your exhale to bring that heart rate down. Like, focus on your exhale. And like, it actually makes such a huge difference. So if you're doing that, pairing that with like feet up, it's amazing what that can do for you. So some other little ones that I always think are interesting are electric shocks. So often these precursors are to hot flashes. They radiate from areas on your head or extremities, and it's theorized that these mild to severe jolts of pain can be ascribed to hormonal imbalances that affect the hypothalamus or to neurons that are misfiring in the nervous system. And sometimes medical intervention is actually necessary for that one. So like definitely go get that checked out. But that kind of like electric shock feeling is tied to hormonal imbalances as well. Same with changes in body odor. So like we might start seeing changes in the way like we smell in terms of like urinary, like when you go to the restroom, or fecal odors, or like even pungent perspiration scents from like our hot flashes and night sweats. Like some people call it like stress sweat, is what like I used to have clients say. They're like, my sweat just smells different. It's like, I'm going to call it stress sweat. And I'm like, okay, sure. But it's like, it's the hormonal fluctuations that affect your thyroid's impact on like your vaginal pH, or we have incontinence, or we're not actually like getting rid of things from our body and like detoxing regularly. So things just like accumulate. Then you can get like fishy type odors, and like you get all these different smells from our body not being able to get rid of stuff properly. So it just becomes more like pungent almost. So making sure that we're like drinking enough water, that we're getting enough fiber in our diets, that we're moving around, that we are addressing our stress, that we are taking care of our liver health. Like these are all things that again are so important, but we end up, cutting our calories and doing crazy amounts of cardio, and we're avoiding our carbs, so then we're not getting fiber, and all of these things that can then like just make all of this worse, that again, a lot of women don't realize is like attributed to these like changes that we're seeing, because we know digestion slows down. We know that we're starting to see changes in like pH levels and stuff like that because of changes in estrogen. So like we really need to support our hormones and our stress levels as best as we can. But typically what we end up doing, because we're so focused on fat loss, is we start doing the opposite things, and it works against us. And we don't feel like ourselves, and like we're self-conscious and we're bloated and we're not feeling good. So another one here that I wanted to talk about a bit here is breast sensitivity and pain, because this is something, lots of us will start experiencing that during like PMS type symptoms, but it can actually get a lot worse during perimenopause and menopause, or you never had these things and now you're experiencing them, and then people are like, oh man, am I PMSing now that I'm in menopause? This doesn't really make sense. So Corinne, I'll let you touch on that a little bit.
Yeah, I think it's really great that you brought up, because I think this is a symptom that many women experience even when they just get the onset of their period. Like we go, oh, breast tenderness, that's normal. That's what we experience our whole life. So yes, that's true, because we do experience hormonal fluctuations all the time. So there will be a certain amount of sensitivity, pain, tenderness, like as you naturally have your cycle. However, as we go into perimenopause and menopause, like hormonal spikes can cause a lot more fluid buildup and retention, and especially in your breasts. So that tenderness and swelling can become so uncomfortable, so painful, more than what you should experience or feel. So this especially is really common in clients that we've dealt with that have IUDs or on HRT for like multiple other reasons for other symptoms they're experiencing as a side product. Like you end up experiencing more fluid retention, more swelling, more tenderness. I have this with actually a client that I work with all the time now who has a lot of estrogen dominant symptoms. Like we're dealing with that. She deals with a lot of inflammation and swelling on the regular. So we're dealing with detoxification. So it's like as a whole, you really want to make sure that you're paying attention to what is my level and how does it feel? Like, is this where it's manageable, or is this where I can't even sleep with a sports bra on because it's so uncomfortable? Like how bad is that pain and tenderness? Because there's certain symptoms that we think, I just have to deal with this, as you pointed out earlier, but it's really where your quality of life could be so much better if we just put certain practices into place.
And I do think it's like really interesting how like a lot of women who are on HRT or IUDs, this is a very common side effect. And it's because like we can see an accumulation of like hormones like that, especially if we're not detoxing things well, right? That our body will like accumulate if we're not like able to get rid of, especially if the dosage isn't correct, or like they don't get tested before they're put on it. And then like HRT and stuff, like, yes, like bioidentical is like definitely the way to go if you're going to be on it. But there's some people who like, that's not an option, and they have to go on like the other like progestins and stuff like that, and they can have these like side effects, right? So I always found that very interesting, and this is why like pay attention to how your body feels when you're making those changes, but also it's like how can we improve things naturally as well to make sure that we're being able to be in our best health and get our body functioning the way it's actually supposed to. Another one that I think is interesting too is like the tingling sensation throughout your body. It's almost like prickling or stinging, like pins and needles, or like a crawling feeling almost. And sometimes it even comes across as like numbness, and that's experienced and are linked to lubrication loss due to decreased estrogen. Like, as you can see, estrogen and stress pretty much covers everything. So being able to support that's really important, but people don't realize like that kind of stuff is associated to estrogen, and people start freaking out. They've got like all this nerve damage or things like that, right? When really it's like our stress levels are too high, our estrogen's too low, and we need to do what we can to support our body that way. The other one that I do want to talk about a little bit here is some dizziness and vertigo. So this is something, Carrie Ann and I were actually just like discussing this morning on a call together, where we are seeing a lot of women who were good, and now it's like they get dizzy, they get vertigo. It can be associated with like blood sugar stuff as well, and that there's some hormone fluctuations that can really affect that. So Carrie Ann, why don't you touch on that a little bit?
Yeah, I think there are a lot of different reasons that some women can experience dizziness, vertigo, or, lightheadedness that maybe feels like it came out of nowhere. I think a lot of the times, again, estrogen does create this really important buffer in our body. It helps regulate fluid balance. And then when our estrogen tends to go down or it starts to fluctuate, then a lot of the times our body doesn't have that really good ability to even like level out mineral balance and water balance and fluid balance as well as it used to. So we do see that clients do get it's almost like a blood pressure or blood sugar issue for sure, where they do get that dizziness and vertigo. I also think something else to note is that we had talked about immunological cells, and our immune system does get a lot more vulnerable when we do lose those levels of estrogen and progesterone that helped us buffer or like create a stronger immune system. And sometimes we do see that like women are just a lot more susceptible to more viral load. And a lot of the times the vertigo, especially if it lasts for long periods of time, can actually be associated with like viruses that you catch. And you don't have to get super sick for that. It can be like an inner ear infection, or it can be like a virus that you are fighting off for a period of time. And your immune system is just like not as powerful as it maybe used to be. And so we do see like weirder side effects with viral load as well. But I do also think a lot of it is blood sugar related. And a lot of women go into menopause under eating or like trying to diet and trying to prevent weight gain. And unfortunately, that causes a lot of low blood sugar and low blood pressure, which can, create a recipe for disaster when it comes to having dizziness and vertigo on a consistent basis too.
Yeah, and I think like the big thing here for like women to realize is like our body becomes so much more sensitive when our estrogen levels drop. Like so much more sensitive to literally everything. It's like, it doesn't take as much to throw off your digestion. It doesn't take as much for you to start experiencing these like weird side effects that like you think might not be, associated with menopause. Like you think it's just like, oh, maybe I'm just aging, or maybe there's something like really extremely wrong with me. And it's like, are we supporting your hormone levels the way that you need and like adjusting what life looks like? Because I mean, think about it. The kind of things that you're doing when you're a kid versus a teenager versus your 30s versus your 50s versus your 80s, your lifestyle changes based on what your body can tolerate and handle, right? Like, but I think a lot of the time we're just so focused on ignoring the signals that we're getting. Like every symptom that you're experiencing is like a sign from your body that like we need to change something. Is like really what it is, but we're so good at ignoring what our body's telling us, right? So it's being aware of these things and understanding that as our hormone levels start to decline, that stress tolerance really does decrease. What we can handle really does change. And yes, we can build up our stress tolerance, absolutely. But if you're coming in a place where you're already experiencing so many symptoms and you have so much stress and you are under eating and you are doing a ton of exercise and you aren't sleeping properly, of course you're going to have symptoms because your body is like literally yelling at you to like slow down. It's hard to, because we all want to push, we all want to be productive, we all want to lose the weight, but we need to realize like the weight gain and the symptoms are a side effect of something going on in our body that we're ignoring. And I think we get so good at ignoring that and being like, no, the answer is to push harder, to do more. And like, it's a hard thing to wrap our heads around. And I mean, I'm that way too. Like I literally will work and work and work until like my body's just like, okay, you're done. Because you're crying every 10 minutes. Your emotions are crap. Like you're not sleeping. Everything hurts. Like and I'm the same way, and it's really tough. And it's hard, especially when you've been wired that way for a very long time. And it is hard. We do live in a society where we do have people pleasing tendencies, where we put people ahead of ourselves and our self-care and our careers, everything. We want to be productive, and you feel guilty taking time to slow down, or it feels wrong to not work out 6 days a week. And the idea of only working out 2 or 3 days a week is like terrifying, or having to eat more, or like all of these things. It is uncomfortable because it is different, but like we're so used to being on all of the time that then when we slow down, it feels wrong. But like, you have to realize that with the internal changes that are happening, you have to adjust, because like your body really isn't the same the way it used to be. So I do want to kind of like wrap things up a little bit here, but like coaches, is there anything else that you want to touch on in terms of like what you're seeing, or what's the most challenging thing? I mean, we see women see huge changes in hormonal symptoms in as little as like 6 weeks. Like it's pretty wild what we can see improve in terms of like hot flashes and energies, as we always do this hormonal symptom assessments pre and post, like when they first come in, then before they go into a fat loss phase. And that helps us figure out if their body's actually like adjusting and ready. And we see some amazing changes, and it's awesome. But what are some things that like maybe like you have to have conversations with clients, because getting people to pull back is always hard. But what are some of the conversations that you have? What are some of the tactics that you found very helpful for women kind of getting control over their bodies again? Because I think that's the biggest thing. It's like people get so desperate. How can I get back to feeling quote unquote normal? Because it's really hard, right? So Carrie, I'll kind of let you start. What are you seeing and doing with clients?
Yeah, I think, the biggest piece of advice that I bring into new clients, but also just anyone who's trying to do it on their own, who's listening to this podcast, is we cannot stress enough the power of consistency and sticking to something for like 3, 4, 5 months and seeing how your body responds. I think a lot of the times, first of all, we're very impatient. And we change things up too often. And we also don't use the right, what we would call biofeedback, to actually assess the situation. Another thing that I would encourage when it comes to consistency there is what you can measure, you can manage the best. So why change things when you don't even know what's going on right now? And that's why we always get our clients coming in to make sure that they track their nutrition, and we do all those intake assessments, because we want to meet your body where it's at. And the more that we have in terms of like a quantifiable measurement, the easier we can actually make goals for you. And you can do the same. You can self-rate your energy. You can self-rate your sleep out of 10. You can track your nutrition intake really honestly and see where it's going day to day or week to week in terms of fluctuations. And it might seem like hard work at first, but you have to choose your hard, because you can gain control really easily if you can measure what you're doing, and then you can make very small and very efficient changes moving forward from there, because you have all your information, and then you can stay really consistent at it. Or you can continue to struggle and continue to feel worse, unfortunately, and that's also an element of hard. So in my opinion, it's kind of a little bit of tough love, but choose your hard. It's going to be hard no matter what. Do you want it to be hard for a short period of time and then you feel better? Or do you want it to just always be hard, is usually like my little tough love that I will give even people who are trying to do this on their own. And it takes a lot more work when you don't have the support of a coach, right? And you just have to be okay with that if you're doing it on your own.
Corinne, what about you? What are the conversations that you're having, or like tactical things that you're doing?
Yeah, something I think is huge, whether, again, you are doing it on your own or you're doing it with a coach. I find this goes over way better when you have a coach for support, but it's having your mindset shift of knowing that I need to repair my body. I need to take care of my body. I need to let it know that it's loved, that it's healing, that it's being taken care of in a positive way. And I need to shift my focus away from weight loss and fat loss. I need to just be okay right now in giving my body what it needs to be safe, protected, healthy, happy. And ultimately, I've seen so much more success with women moving forward when they can separate the two. When it becomes, I need to take care of myself, I need to improve this relationship with my body, with food, with exercise, and then the results follow, and it's so much faster. I find, like, it even did this with someone who is in a fat loss phase, because she was so focused and driven on, I want to see fat loss, I want to see weight loss. And I say, let's just transition right now and change things up and change our focus completely and not even worry about that. And what happened? Results followed. So it's like, if you can take some of that strain and stress and focus away from some of the external things that you are hoping to see and achieve, it's going to come. It will be there. And right now, invest the time in getting your body internally aligned, feel great. Like, you are going to end up loving your life. You're going to end up waking up feeling awesome every single day, and you're going to go, I don't even care what happens now, because I feel so good in my body, in my life, in my relationships. Like, it's going to affect everything around you, not just your symptoms, but also the whole aspect of your life. So improving all of that first and focusing on that will lead you to the success that you want to see.
Yeah, I would agree with that. Like, it gives you like an aspect of control, because like when we don't feel in control, like it's so easy to spiral. So easy to spiral and like freak out, right? And like, I'm not there yet. And like, the reality of the situation is you can't control what the outcome is going to be. You can like set yourself up to like increase your chances of achieving XYZ outcome. But like, if you focus on like the little goals, okay, I'm going to hit these targets, I'm going to focus on my sleep, I'm going to do the de-stressing, then, and like, you just don't worry about that end goal, like, you will get there so much quicker and you will have a lot more freedom coming from it. And like, those are my favorite check-ins, when people are like, oh man, I'm not where I want to be yet, but like, I feel good and I'm at peace, like knowing it's going to take a little bit longer, but like, I actually feel like I have control over my life again, which is like such a good feeling. Britt, what about you? How do you have this conversation with clients, or how are you helping them kind of navigate the symptoms and getting control again?
I think a really big conversation that I have with a lot of clients when they come in is, I hear oftentimes, my biggest goal is to lose weight. I really want to lose weight. I have X amount of pounds I want to lose. I want to I want to fit into this. I want to fit into that. When can I get into a fat loss phase? What's the earliest I can do this, right? And so I think a really big thing that I have been talking to a lot of clients about is that idea of, one, rest is really important, right? And so resting from pushing so hard in the gym, not going 6 days a week, maybe not going 5, maybe not going 4 days a week, right? Maybe going the 2 to 3 days a week. Taking those longer rest periods in between, right? That's really, really hard if you've always been doing more HIIT-based training, circuit training, high intensity stuff, right? To sit and actually take 60 seconds, 90 seconds, 2 minutes of a rest period in between, that can feel like hell for a lot of people, right? Because I'm not working out now. My heart rate isn't going up, right? But what's really important to understand is, like, everything grows when we rest. So not working out as hard. You're probably actually going to see a lot more benefits in the gym because you're not pushing as hard and you're actually focusing on 2 to 3 quality weight training sessions a week, right? Resting periods in between. They promote muscle growth, right? So you are going to build the muscle that we want for the fat loss phase. Resting in the sense of maybe saying no to things that normally we feel like we have to say yes to, right? Putting up the boundaries, right? That's a form of rest. Maybe taking that self-care time 10 minutes a day, doing that feet up, right? You're going to grow in all of these areas because you are prioritizing rest in different ways. So that's been a really big conversation, and that's like a hard one that I think a lot of people are struggling with, like, because we had just talked about, like, there's such a culture of this hustle culture, going until you burn yourself out. There's so many women that come into this program with adrenal burnout, adrenal fatigue. I've suffered with that, and I'm dealing with still the symptoms of that even after 2 years. It takes a long time to recover from, and really prioritizing that rest is where all that growth happens. And then the other thing that I always try and tell clients is like, when it comes to just our goals and wanting to make sure, like, I want to get to that fat loss stage, is like, we have to look at this pyramid, right? And the pyramid at the base, the most important part is nutrition and hormones. And we have to set that foundation first, because if we don't, we're not going to see benefits everywhere else. And then comes our resistance training. We have to build the muscle. And then comes rest and recovery, right? And so it's like, we want to build this foundation and slowly build up. And like, cardio is up at the top, supplements are up, all these other things are up at the top that play a really small portion. A lot of people feel like, well, if I just do all the cardio and I take all these supplements and it'll fix everything, right? But no, we actually have to do this other work at the bottom to set this base. So those are some conversations I've been having lately.
Yeah. And I think like, people don't realize that when you take that approach, like, the symptoms will improve, and they can improve generally pretty quick for a lot of people. Obviously it depends on like the severity, how long you've been in that state for, and things like that. But like, I don't think people realize how much the pushing and chasing the weight loss like is actually like pushing them further away from their goals. And like, the symptoms that you're feeling, and like the not feeling in control of your body, and like all these weird, crazy menopausal symptoms that we talked about, even though there's like way more, there's like 97 different kinds of symptoms that you can experience from menopause, which is wild, but they're all telling you something, because they're all caused by something. So it's really, are you taking the time to figure out why that's happening? Because if you don't stop and address that why, like, are you really ever quote unquote fixing the problem? Like, no, it's just still happening underneath the surface. And I think, again, it's really hard when we all have this like aesthetic goal, and we're like, if I could just lose this much weight, then I'll be happy, then I'll feel good. And it's like, no, like, we've seen people lose the weight and not feel good. We've seen, like, you've done that stuff before, and like, your body is different now. So we need to help you understand, what do these things mean? How does it impact my body now that I'm experiencing these hormonal changes? How can I best support my body so that I'm like actually taking care of it while still working towards my goals? But again, we're all just so focused on pushing hard and go, go, go. And the symptoms get worse. And if your body isn't ready and you try to cut your calories, those symptoms come back. And that is a very clear sign you are not ready. You have not healed long enough. And then you need to come out of it. You need to take that time. You can't keep pushing, because it's not going to benefit you long term. It's just going to put you back further than what you want. And like, most women, this is a long journey. It is. It's not going to be 6 months and done. We're healing, we're working through it in the 6 months. Like, you'll probably get to a fat loss phase, right? But we have some people that, they came in eating 800 calories, and we got to get them to like 2,300. That's not a 2-month thing. That's like a 9-10 month thing. Because you can imagine when you're eating that little, there's a lot of stuff going on, right? And like, so we need to address those things. But then it's like, now they're thriving. They're doing great. They're actually, the client that I'm talking about's pursuing her nutrition coaching certification as well, which is really exciting. So you just have to really understand and like take the time to learn, take the timeline pressure off, because that's going to help you. And again, if you're just ignoring these symptoms and trying to take things to mask them, you never address the why. And that why is probably preventing you from reaching your goals. So that's really what it comes down to. Hopefully this was helpful. Hopefully you feel a bit of comfort knowing that these things do happen. They're common, but they're not normal, right? Like, they happen when your hormone levels drop, when you're experiencing more stress. Should they be happening? Probably not. Like, we got to address things, right? But like, there are ways to go about this. So if you are struggling with anything at all, whether it be weight loss, whether it be hormonal symptoms, just message me. I'm always happy to chat. help you figure out where things are going wrong. And we're always going to tackle things with nutrition first, because that's something you actually have a lot of control over. You just got to decide if you're willing to take control, is really what it comes down to. So thank you so much for listening. I hope you guys enjoyed this episode. Make sure to share it, and we'll all talk to you soon. Bye.